No voice.
We are live.
Hello, good evening, everyone. So, today is a patient awareness talk on the topic of hands on healing, manual therapy plus exercises for your stronger and happier knee. So, last month we have discussed a topic which was on total knee replacement surgeries on OME patients. So today, this month, we are discussing regarding the almost similar topic that will be mostly focused on the exercise as well as manual therapy, which will help you to get rid of your pain and stiffness, which is coming from arthritis in your daily life. Okay, so now this is this. Okay, yes. So we'll start today's topic with brief introduction of osteoarthritis. What is osteoarthritis of the knee? Most commonly, it will be on the knee joint because knee joints are mostly weight-bearing joints of the human body. So mostly affected joint will be knee joint. So in the osteoarthritis, as we discussed previously in last talk, that it will be involved with a lot of pain and stiffness and difficulty in functional activities. In today's talk, we'll discuss regarding uh, its treatment part, which is mostly conservative treatment part, which will include manual therapy as well as exercises, which you can do easily at home. And I have some videos which will explain you some bony, whatever bones are involved in the knee joint, what are the muscles, important muscles are involved in the knee joint, and exercises as well as some manual therapy. So you will get some idea regarding how manual therapies are get done and how it will help you to improve from the pain or stiffness or whatever functional disabilities you are getting in your daily life. So we'll start with this short video, which is showing the parts of your knee joint. Okay. So as you can see, this upper bone over here, this lower bone, which is called as a tibia, and this kneecap bone, which is called as a patella. Okay, so these three bones are main bones which is forming the knee joint. So in knee joint, there are two major joints. One is this femur and tibia, this upper bone and lower bone, which is making tibiofemoral, and this kneecap, which is forming patellofemoral joint. So these two joints are part of the your kneecap thing, knee joint. Okay, so I'll just stop this. We will move with the line. Just okay. So as we seen in the video, there are total three components in the knee joint and forming two joints. So most common arthritis is tibiofemoral, and patellofemoral is very less likely. So if you have any previous injuries or any traumas in your knee joint, any fracture related things or any soft tissue injuries in the knee joint, then we'll get mostly that second kind of, which is patellofemoral osteoarthritis. So now we'll move forward with the second thing, which is muscles involved in the knee joint. Okay, so now we'll move with the second video, which is yes. So in this video, we'll see the muscles which is very important for the knee joint. Okay, so this is called quadriceps muscle, which is front of thigh muscles. This is most important muscle and most painful muscle in osteoarthritis. Okay, the second muscle, most important muscle, will be hamstring muscle, which is over here at the back of thigh muscle. Okay, and third muscle will be this glute muscles, which is your buttock muscles. That is also providing lot of support because it is extending as a single fascia, which is called IT band, and it is inserting in the knee over there. So this will also one of the painful muscle in the knee osteoarthritis. And third and fourth and last muscle, which is very important for your arthritis knee joint and painful muscle, will be the calf muscle. It is made up of total two major muscles over there. Okay, so that is there. Um, yes, this is also done. Okay, so now today's main discussion, if the like manual therapy, how it works, and what and all exercises are there which will help us to do at home and get rid of all kind of pain and stiffness and whatever things are coming because of osteoarthritis. So for that also we'll discuss in detail. So for that also again we'll start with the video. So as we can see, this is called patellar glide. So first, we'll understand why and what kind of manual therapy we are using to treat the osteoarthritis. So, osteoarthritis generally affect all the surrounding structures, which includes all the major muscles as well as your joint. Okay, so joint includes all three bones, which we previously seen in the video, which is tibia, femur, and the kneecap, which is called patella. So these joints will be very stiff, so which will make your muscles very tight, and your muscles will start losing strength day by day. So eventually, because your muscles are very tight and weak, you will face a lot of difficulties in daily functional activities like sit to stand, or getting up from the bed, or your daily activities, walking, climbing stairs, and all the activities. So now, as uh, we'll see in the video again, what and all major manual therapies we are using. So manual therapy, will understand what is manual therapy or hands-on techniques. So hands-on technique or manual therapies are mostly used to reduce your pain and whatever stiffness is generated in your joint. To reduce that, manual therapy will help. So that will be used by professional physiotherapist, and it is very skillful techniques. And there are multiple techniques or multiple joint mobilization, or some soft tissue release techniques which will help us to get rid from the stiffness and painful joint, and it will help you to reduce swelling, pain, and stiffness which is coming in the most of the time morning, or if you are sitting more than half an hour or more than that time. So manual therapy basically manipulate the different bones which we see in the videos. So suppose your patellar bone is very tight and very difficult to move up and down, then we have to mobilize it with the special techniques. So for that we'll see video, so we'll get better idea how to properly get it done. Okay, so this video again we are sharing over here, as we are seeing in the video, this is called patellar glide. So in this particular manual therapy, we are gliding your patella side by side. So what happens in osteoarthritis is your patella will not move smoothly because your quadriceps muscle will be very tight. Okay, so because you are having a lot of pain and stiff swelling will be there, so you will be very in too much of pain to move your knee joint. So eventually your all the muscles will get tight, and your quadriceps muscle is attaching with the this kneecap bone over there, and it is attaching on the tibia over there. So because of tightness of your quadriceps muscle, your patella, which is kneecap bone, will get very tight. So this patellar glide will help you to move that bone very smoothly, and it will improve your knee ranges, as well as it will help you to reduce a lot of pain and stiffness in your joint. So now this is the second manual therapy we are using to treat most of osteoarthritic patients, is this inferior glide. So that was side by side. This is called inferior glide of patella. So that will also help you to get rid from the pain and the stiffness which is formed in the kneecap muscle. Now, third one is superior glide. We called as a superior glide of patella. That is also one part of the patellar mobilization only. Now, this is called tibiofemoral mobilization. As we mentioned before, there are total two joints involved in the knee arthritis. So, first one was tibiofemoral, second one was patellofemoral. Now, tibiofemoral mobilization. Here we are holding your upper thigh bone and we are pressing the tibial bone downward. So that will break the stiffness which is forming because of inactivity of your bone, and lot of stiffness and swelling will be there. So that will help to reduce that. Now, next one is called anterior glide of your tibia. So this also will help you to improve your range of motions and help you to get rid from the pain and the swelling. Okay, so this is called Mulligan mobilization, which will help you again to improve your range of motion, which is hampered because of stiffness and the swelling in the knee joint. And this is last one is Mulligan distraction. So we are basically distracting your knee joint. So in arthritis, what happens? Two bony surfaces will come in close contact, and eventually it will give you a lot of pain and disabilities. Okay, so to reduce that uh, close contact of the bone, this distraction will help. Now, as we seen multiple videos regarding what manual therapies are, this kind of different manual therapies we are using for treatment of our whatever osteoarthritic related patients, and they are giving excellent results which will improve their pain levels, whatever their stiffness levels. Most of the patients will have early morning stiffness, and uh, all daily functional activities are very difficult. So eventually, this all techniques are helping them to get rid of all these disabilities. Now we'll move to the exercise part. So manual therapies are done by professional physiotherapists, so it won't be able to perform at home. But we are showing in this video today because it is very important to understand how it functions, or what are the importance of that particular manual therapies. Okay, so now we'll move forward with the exercise part. So exercise part is also including multiple videos, so that will be very easy for you people to understand how that exercise. You can laterally save these videos also, So it will be very easy to perform those exercises. If you are suffering or any of your relatives are suffering from any kind of knee pain, then all these exercises will definitely help them to improve with their function and with their pain levels. Okay, so now I'm going to share those exercises with you, and each and every exercise, with exercise also I'll give you some tips which will help you to get that exercises properly at home. Okay, so that will also help. And lastly, we'll take all pay like whoever have some questions regarding that questions will give proper solutions of that questions. So last, this video is including exercises. So I'm gonna share that video next. So this is now exercise part that we are gonna discuss. So first exercise is terminal knee extension. So most of the time what happens with severe pain and swelling, you will start losing your multiple movements. First movement which is get most affected is knee extension. Knee extension is backward moving of your knee joint. So it will give you a lot of difficulties in walking, climbing stairs, and getting up from the sitting position. So to improve that range, this exercise will help. So for that, what we are going to do is take a one resistance band, tie it somewhere at the window or any chair or sofa, and take it as a at a exact the knee joint. Behind the knee joint you have to put it, and slowly you have to start extending your knee, as we are able to see in this video. Okay, so this is your first and very important exercise, because daily functional activities are like walking and climbing stairs and sit to stand. All the activities will be painful, and this exercise specifically will improve your pain levels as well as your range of motion in the extension, which is backward movement of your knee joint. Now, as we shown in the video, that important muscles. So there are multiple muscles, which is very important. Now we'll see muscle wise particular exercises which will improve strength of that particular muscles. So first exercise for that muscle strengthening will be glute bridge. This is very common exercise we are doing in our daily life, but we can use a band. So that band will give you extra resistance for the other muscle to get activated, and will do lift our back upwards. So that will activate your glute muscles. So as you can see in the video, the same, you have to squeeze your buttocks toward the ceiling. So that will activate your glutes. Now this is clamshell exercise. Next one is, that is also for your glute muscles only. So glute muscles are three in number. There are total three muscles which is involved in glute area. So this is for glute medius muscle. That is also very important for your knee support. So here we'll put a band, we'll lie down on the sideline position, we'll bend our knees to 90 degrees, and after that we'll start lifting the knee upward. Okay, so this will activate your glute medius muscle. Now fourth one is hamstring curls. So hamstring is also very important muscle, and most of the patients will have a lot of pain in hamstring because eventually we are missing extension movements. So hamstring muscle will be inactive. So to activate that muscle and to improve muscle strength for the hamstring muscle, we'll start doing this hamstring curl exercise. So here also we can tie a band to some rigid thing there, and then Other end should be tied at the ankle. We have to lie down on the prone line or ulta, and then we'll start bending our knee. So this will activate and strengthen our hamstring muscle. Now next one is quadriceps. So as we discussed before, quadriceps is also very important muscle and most painful muscle. So to strengthen your quadriceps muscle, we'll sit in high sitting position. Down we'll tie the TheraBand over there, and then we'll start extending our knee. Extension is straightening of the knee. Okay, so this now calf muscle is also very important because it is working as a shock absorber. So because in later age, because of wear and tear, your meniscus, which is cushion between your two bones, which is tibia and femur, part of the knee joint, is already get degenerated. So calf muscle strength is very important. Whenever you are walking or climbing stairs or coming down from the stairs, you are transferring so much weight on your knee joint. So if your calf muscles are not strong enough, your knee joint will have a lot of weight bearing, and whatever degeneration process is happening, that will be little speed up. Okay, so this is very important to improve your calf muscle strength also. So we can do this inclined calf raises. At the wall support, you have to be little inclined, both the knees straight, and then you can do this double leg. So that double leg exercise is initially you can do. Later, after 2 3 weeks of regular exercises, you can make it single leg, which is progression of the same exercise. Each and every exercise have multiple progressions. So that for that you definitely can visit nearby physiotherapists that will help you to progress with the same exercises over there. So this is one of the progression of the calf raise exercise which you can do on the single leg. Now squatting. So squatting is the most affected movement in the osteoarthritis of the knee because lot of stiffness and pain and swelling will be there, so we'll stop bending our knees. So squatting is one of the most important exercise for your daily activities, like including coming down from the steps, sit to stand. Every activities will have this squatting mechanism in each and every movement. So basically you're bending your knees and hip joints over there. So to activate that, you can start initially with table or chair height. You can put one pillow over there to reduce the height if you're not able to go completely down there and do squats. So this exercise will help you to improve your knee ranges and lot of strength in the quadriceps muscle. So as you are able to see in the video, I have kept a pillow with, so you can same way you can keep pillow if you are not able to go completely down there. And eventually later on, once your pain levels are coming down or you are improving with muscle strength, you can remove that pillow to go deeper levels for the squat exercises. Now next last exercise will be reaching out or with the step downs. So step down also, as I mentioned, it is very important functional activity. You can do this exercise to improve your pain-free stepping down. Okay, so this exercises are there which you can do at your home daily to improve from your knee joint stiffness as well as pain. Okay, so now we are going to cover a few questions from our viewers. So Shilpa is asking, what are some effective ways to prevent knee pain? So as We discuss in today's online session with help of multiple videos that there are multiple ways to prevent your knee pain. One of the most effective ways to do regular physical activities, in the sense any kind of physical activities which includes running or walking in the sense little paced walking, or some physical activities in form of exercises. So exercises I have shown which is very easy to do at home, so you can definitely save this video for future references, or definitely if your family members or any relatives will have any kind of knee issues, then definitely they can prefer these exercises. They can start doing the exercises regularly. Main thing is consistency. If you are doing all these exercises consistently at least for 4 to 6 weeks, then definitely it will help you to prevent your knee pain effectively. Okay. So now next question is coming from Chitra Yadav. What are the benefits of maintaining strong knee muscles? So yeah, it's very good question. What is the benefit? So why we are doing these exercises? Main benefit is improving the muscle strength of surrounding knee muscles. So knee muscles are helping your joint to move, and it will help you to do your functional activities. Why your muscle strength is very important is, so if your muscles will be strong enough, it will take a lot of load from your bones which is coming from the ground. Okay, so whenever we are walking, coming down from the steps, lot of shocks will be there, and it is directly absorbed by the muscles. If your muscles are strong, it will maintain your joint in the proper shape. It will stabilize your joint, and it will reduce lot of stress on the joint. So that will help you to, whatever. So basically, osteoarthritis is wear and tear of your knee joint. So knee joint, at the end of the bone, there is one cartilage which is soft structure, and with years, like osteoarthritis is mostly age related thing. Okay, so if with the age you are using your joint, and if your muscles are not strong enough, it will start loading your joints too much, and it will put a lot of load on the joint, and eventually your cartilage will start getting damaged. So because of that cartilage damage, that there will be some osteophyte formation in your knee joint, and it will start degenerate your both the bony surfaces which is included in your knee joint. So eventually that will turns in the osteoarthritis of the knee. It will include lot of stiffness, which will make your joint very difficult to move freely, and lot of pain associated with inflammation or swelling. Okay, so if your muscles will be stronger, you will not, or you can easily delay, or you will not have any kind of joint direct stress on the joints. Okay, so now next is Pramila. What role does nutrition play in the maintaining healthy knees? So nutrition wise, main thing, there are a lot of nutritions which will be missed, and it will eventually help deteriorate your muscular and bony health. So mostly uh, osteoarthritic patients should look for their vitamin D3 levels, calcium levels, and daily their protein intake if they are doing regular exercises. So vitamin D3 is very important to maintaining your calcium levels in your body. So vitamin D3's main work is to absorb calcium from your food, and it will restore that calcium in the muscles as well as the bones. So if you don't have vitamin D3, then it will start taking from the bones, and the whenever your body needs calcium, it will start reabsorbing from the bones, and it will eventually make your bones little weaker. So osteoporotic changes will be little higher where patients have very lack of vitamin D3 and calcium levels. So if you are having lack of protein intake in your daily food, then it will definitely affect your muscle mass. and your strength levels also. So protein intake you have to improve. You have to daily sit under every early morning around 8 to 10 o'clock. You can sit under the sunlight, which will provide you a lot of vitamin D3, and that will eventually help you to restore your calcium from the food, whatever you are having. That will restore in the bones and the muscles. So muscle is also, demanding a lot of calcium to contract and relax. So vitamin D3 will be one of the most important mineral which will play a role in the knee health, or like all over your bone and muscle health also. Now next another question is from mm, Sangeeta. What are some effective ways to prevent knee pain? So that is already done. Okay. Yeah. So we are done with the questions today. One more question is there. That is from Jeevan Jaguar Gowda. How can proper footwear choices affect knee pain? Yeah, very good question. Okay, so footwear. So whenever we are moving out, we are moving with the footwear. So footwear is our like part of our daily activities, whatever we are doing outdoors. So whenever we are having improper footwear, that will again increase lot of loading on your muscles and the bones. So if your footwear is very firm or very soft, it will not hold or absorb that much of shock from the ground, and eventually it will affect your bone health and the muscle health. Main thing, it should provide a lot of support to your plantar arch also. If your arch is dropping or your knee muscles are weaker, then that footwear should support your arch and improve your, whatever normal arch or whatever muscle related balance will be there. It should maintain that also. Okay. So that also footwear is very important for any kind of knee or any kind of heel related pains also. So that also we can look into it. Okay, so now today we are done with all the questions also. Okay, so hope all the viewers got some insights in their, whatever knee related problems they are facing, and whatever exercises or questions they asked, they got proper solution. If anybody in your near and dear family members will have any kind of knee related issues, then you can please share this video or the exercises, and that will help us to serve better next time also. So will be very helpful for us. So please like and share this video. That will help us. Thanks a lot. Good evening again, and thank you for viewing this video and sparing some time. We'll see you next month with the better topic, which will include so many insights for another problem which is faced by normal population. So our main target is to educate patients or viewers regarding any kind of common problems which they are facing in their daily lives. So we'll try definitely next month also with proper topic which will help to the viewers with get some education or any insights for the particular problem. Thank you. Thanks a lot. Good evening. Good night.